My guest at this time is Grace Marie Turner. She is president of the Galen Institute, one of the most respected healthcare policy firms in the nation. We want to get her thoughts on former Vice President Joe Biden touting his healthcare reform plan as Obamacare 2.0. Biden is also pushing a public option as a more moderate option than Medicare for all, which a few of his Democratic rivals are doing. But what would the actual impact of the public option be? We'll get to all of that in just a moment. And Grace Marie, thanks so much for being with us.
Greg, always a pleasure. Thank you.
Well, you and I have these discussions pretty frequently, and as I like to say, you've been with us every step of the way since the dawn of the Obamacare debate back in 2009, and really even before that. And one of the things we heard a lot during that debate was something to the effect of this from the president.
We will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period.
And Grace Marie, as we've discussed over the years, that was not the case. One outfit called it the lie of the year. Because of the new regulations, no plan got to stay the same, and so therefore nobody got to keep their plan, and people on private insurance away from their employer probably struggled the most on that. So Joe Biden is coming out with what he calls Obamacare 2.0, and here's how he pitched it as he pushed a public option.
So I give people the option. If you like your health care plan, your employer-based plan, you can keep it. If, in fact, you have private insurance, you can keep it.
So we'll get to the merits or the demerits of the public option in just a moment. But Grace Marie, what did you think when he phrased it that way?
It was amazing to hear that. In 2013, as you said, Politifact said that President Obama's promise that if people can keep their life, their doctors and their plans can keep it, was the lie of the year. So my question is it possible for the same organization to give two different presidents, were Biden to be elected, the award of Lie of the Year for saying the same thing, basically, 7 or 8 years apart? Goodness gracious, it's just his plan. The public option will absolutely drive private health insurance out of the market. There's no way. Public option is basically the government saying, well, we're going to set up our own health insurance company, and it's going to have to compete, of course, with private plans. But the federal government has unlimited calls on taxpayer dollars. It can write the rules that everybody has to comply with. Private plans will not be able to compete. So people will inevitably lose their private plans simply because they will go under. So the plan is a mush. Former Vice President Biden's plan is a mush of a plan, but they all basically get to the same place, which is a government-run, single-payer healthcare system, whether or not you do it intentionally or you do it because you drive out all private options.
Go into that in a little more detail when you're talking about government regulations or that the federal government can pull as much as it wants from the taxpayer. Explain what you see happening as the government, if it were to do this, were to create a competitor to private insurance over time. What would happen to premiums? What would happen to what's covered in plans? How would this evolve?
Well, the federal government basically would be able to force doctors to accept price-controlled plans, and eventually they would have such a large share of the market because they would be able to offer much lower premiums. The private plans would simply not be able to compete with that because the government not only would have price control authority, it could write the rules of how the plans have to operate, what they have to cover or not, and it also has an unlimited call on taxpayer dollars to be able to replenish those, to replenish their resources. It's a lot like a loss leader. You know how sometimes a company will advertise television sets on Black Friday, for example, at a very low price because they want to get you in the store to buy a lot of other things. Well, the federal government could basically have loss leader premium pricing. So people say, wow, that's such a great price. I'm going to go with this federal public option plan that's so low priced that no private plan could compete with it because they would lose money doing it, lots of money. And so they basically shut down, and the federal government would drive all of them out and then be able to increase its prices because there would be no more competition.
And I know it's hard to gauge this, but how quickly would this happen? Is it a matter of a few years, a couple of decades here? I just know from the past decade, we've moved from the public option being considered to be on the progressive fringe to being the moderate idea in this debate. So what's your estimation on how quickly this would all unfold?
Well, the insurance companies would see it coming, and I think they would either decide, as some of them already are talking about, as basically saying, well, we're just going to have to become public utilities. All we'll do is process the bills and process the payments and maybe do a little bit of fraud detection to basically become the implementers of a government-run healthcare system, and they'd get a smaller cut, but they basically operate like public utilities rather than health insurance companies.
And what does that mean for patients?
What that means is that they have no choice. That, single payer, one of the reasons that people don't like a government-run single payer Medicare for all healthcare system, and it's not Medicare for all, as you know, Greg, it would be more like Medicaid for all, but a lot of promises with very little payment to doctors. Doctors would quickly find that they couldn't keep their doors open when they were facing 30% payment cuts. Hospitals, 40% payment cuts, and growing over time, according to the Congressional Budget Office. So you'd see many fewer doctors that you'd be able to see, many fewer hospitals that would be able to provide the quality services that they do now, and eventually, we all know what happens when the government promises something for free, that the prices go up and up and up, and we would pay for it through our taxes, and we'd pay for the same problems that we see in other countries, where if you're healthy, it may work fine for you, but if you're sick and you need new innovative medicines, you need some very high-skilled surgery, you may be on a waiting list for months and sometimes years to get the treatment that you need, and it's simply because it's a different form of rationing.
Grace Marie, how do you look at the role played by the insurance industry in the last decade? Back in the 90s, when you were fighting against what was known colloquially as Hillary Care, they were very much opposed to it. Then when the individual mandate got discussed in 2009, 2010, all of a sudden they loved the idea of the Affordable Care Act, even though, as you explained at the time and just explained again, that it meant bad things for their industry down the line. So what's the consequence of the industry jumping into bed with this plan a decade ago?
Well, they'll tell you that they didn't have a choice. They knew this was coming down the pike, and they figured they better work and get the best deal they could out of it. Some of them they fought through different channels to keep this from passing, because one of the things they know is that when you get such a big government system going, they have to respond to government's mandates and demands. They have legal liability if they do not absolutely toe the line for everything that the federal government or state governments, in this case federal government, says they have to do. And so they can't be responsive to consumers anymore. That's why we see these ridiculously high premiums. Somebody told me they're on the Washington, D.C. exchange. They have no other choices. That's the one plan if you're on an individual policy. And she and her husband both have $7,000 deductibles. So for the couple, they have not only the high premiums they pay, but they have $14,000 they have to pay out of pocket before the insurance covers anything. And they have no other choice. So that's what happens. You drive out competition. The federal government says this is what has to be covered. And the insurance companies, in this case the exchange, which is basically, it is more like a public utility, a government-run entity, basically offers premiums that are so high $4,000 a month in some cases for a $14,000 deductible policy that may also have a narrow network, and then you're going to find fewer doctors and hospitals able to play in that arena because they can't keep their doors open. So I just, goodness gracious, we have seen what happens when we have more and more government control over our healthcare system. We need to put patients back in control of choices and give them more choices. Before Obamacare, if you were a young person living in California, you could get a health insurance policy for $50 a month. Now, maybe you're lucky if it's $400, $500 a month. Prices have escalated on average. But they have doubled. They doubled in the first 3 years after Obamacare. They've continued to go up. And people have fewer and fewer choices because the companies are now forced to respond to government bureaucrats, politicians, and regulators, not to consumers who want lower costs for more affordable coverage and a wider variety of coverage by providers that are competing for their business. We do have to rewrite the rule book, and that means moving power and control down to the individual. I believe that having states more engaged, they actually know what they're doing in regulating the health insurance market after doing it for decades. Yes, they need more resources to help those who have chronic conditions, who have expensive conditions. They need money for risk mitigation, to provide high-risk pools, invisible high-risk pools, reinsurance, an ability to help the sickest people get the care they need so that they don't drive up premiums for everyone else. We already have some evidence that that's working with 7 states that have taken just a little bit of the Obamacare money, some of their own money, and they've dramatically reduced premiums. Maryland was expecting a 30% increase in rates last year, and they got a 13% reduction once they did this reinsurance plan. That's a 43% difference in premiums. The states can do this. The federal government is completely out of its element in trying to regulate and oversee something as local and ultimately personal as health insurance. And now we have Vice President Biden basically doubling down. So Obamacare didn't work. What are we going to do? We're going to pour more money into it. Not only is he proposing the public option, but he's proposing also that anybody in the individual market has access to federal tax credits for their health insurance, even if they make several $100,000 a year. What kind of a policy is that? So I think that it needs to go back to the drawing board, and he really, really needs to talk to his marketing people about whether or not he should be promising people they can keep the plans that they have, because we can document that's not true.
Grace Marie, exit question. You very well articulated what is happening, what could be happening, and what you think should be happening. Where do you see the public on this? Are they gravitating towards public option, Medicare for all? Is it the Choices Act that you just described that you think would be a far better way to go and is yielding results in some of these states? Where do you think the public is on this right now?
People are angry and upset, and well, they should be, when they're facing $14,000 out of pocket just for their deductible on top of their premiums. So they're willing to listen when people say, we're going to promise you in Medicare for all you're going to get all the care that you want without any co-payments, no deductibles, no premiums. This is just going to be run through the tax code, and we'll finally be able to get to, quote, universal coverage, and people will be covered. People know they need health insurance, and they're willing to listen to this, and I think it's incumbent on us, those of us who believe in freedom, who believe in markets, to really do an effective job of helping people see that more government is not the solution. More government is the reason we're in this mess. I went to a meeting at the White House on Friday where the Trump administration was talking about all of the things that it has done to try to give people more choice, lower cost, increased competition in the health sector. It's a mosaic of successes, but people really haven't told that story. So we're making some progress with health reimbursement arrangements, short-term limited duration plans, association health plans. Much more needs to be done. But the solution, and that's the contrast of the 2020 debate, are we going to have more government, or are we really going to get a properly functioning market that's responsive to patients and what they want with more affordable, lower cost health coverage that gives them control over their policies?
Grace Marie, the debate continues, which means we'll be talking about this again pretty soon. Thanks very much for your time today.
Thank you, Greg.
Grace Marie Turner is president of the Galen Institute. I'm Greg Columbus reporting for Radio America.